What's the best selective serotonin reuptake inhibitor? Those are the most commonly used antidepressants. What's the best one? It's a fair question. Before I get into that, let me talk about the 10 different classes of antidepressants. The first one, monoamine oxidase inhibitor, has been around a long time. They work great. Phenelzine, isocarboxazid, selegiline. Selegiline was a patch. The other one, nardolepranate, which are phenelzine and isocarboxazid. They're great drugs, but lethal drug interactions. If you take them with dextromethorphan, which is an over-the-counter cold medicine, or you take it with, let's say, meperidine, which is a pain reliever, you could die. You get a hypertensive crisis and die. And I was working in the emergency room in New York, and someone did die, Libby Zion, who's like a famous case. So those drugs are not real popular. And even after you stop them, for 2 weeks after you stop them, they permanently disable the monoamine oxidase inhibitor enzyme, so you could have the drug reaction, which could be lethal 2 weeks after stopping them. Oy, forget it. I don't use them. There's a next one, which is kind of like a serotonin drug and kind of like an old-time tricyclic, anafranil, clomipramine. It's in a class all by itself. We don't use it for obsessive compulsive disorder. Not really my favorite drug. You get the worst of both worlds. Sexual dysfunction that you get from selective serotonin reuptake inhibitors, and you get all the bad side effects of tricyclic drugs, which I'll talk about next, like dry mouth, blurred vision, constipation, urinary retention, visual problems, blah, blah, blah. They're terrible. Tricyclics, these were the tried and true. They work great. These drugs all work about the same. The tricyclics were good drugs, albeit they had one little problem. Fatal cardiac arrhythmias and overdose, and you're giving antidepressants to people with suicidal thoughts, and you're giving them a drug which they could kill themselves with. No good. That's one reason I don't use them. But now, nortriptyline, amitriptyline, diazepamine, and imipramine, those are the 4 in the class. We use amitriptyline for neuropathic pain or for sleep, for migraines. It works well. I mean, they're great antidepressants. Besides all their horrible side effects and the fact you can overdose when you take them. See why we don't use those 3 classes? Tetracyclic drugs called doxepin. It's another class. That's class 4. What's the problem? It makes you so drowsy you can't function. So now we use it as a sleeping pill. Oy. Here's one of my favorites, class number 5. It's a norepinephrine dopamine reuptake inhibitor called Wellbutrin bupropion. It's one of my favorites, but why don't we use it all the time? Well, it works great, doesn't have sexual dysfunction, doesn't have drowsiness, does not have weight gain, very few drug interactions, can cause seizure. That's a problem. And it makes you, here's the worst one, really anxious. So, although it's my favorite, me being vain, like to stay thin and not be drowsy, I like that drug. But take too much, you get a seizure, or some people just get seizures. They think people with bulimia may have a higher incidence of getting seizures than this drug. What's another problem with it? You don't sleep so great, you get headaches, and you get really anxious. Okay, so I use it. We use these antidepressants based on their side effect profile. They all work about the same. So you're manipulating the side effect profile and also how it works. We pick different classes. So we pick, if one class fails, we try another, and we try and pick the side effect profile most tolerated by that patient, or the one we think that's most tolerated. There's another class, the mechanism is not unknown. They affect norepinephrine, epinephrine, and the serotonin reuptake inhibitors. They're not tolerated that great. They don't work that well. Trazodone, it's used for sleep. It makes you really drowsy. Nefazodone, which is Serotonin, and Vibrad, which is Vilazodone, they don't work that well, so I don't use them. Oh, then there's a class in my younger days, not that I'm old, but in my younger days, the norepinephrine reuptake inhibitors. Here's the problem with them. A lot of side effects. They don't really work great. Reboxetine, they use it in Australia and Europe. They can have it. Didn't work that great. What's the other one? Viloxazine, Reniloxazine. They don't work that great. The pure norepinephrine reuptake inhibitors, they did not work great at all. Here's a class that works great. I would say out of all the classes, it may work the best. I don't use it all the time because of side effect profile, dizziness, sweating, sexual dysfunction, delayed orgasm, problems, erection, ejaculation, blah, 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 blah. But they work great. Cymbalta, duloxetine, Effexor would be fenlafaxine, Pristique would be desfenlafaxine, Fetsima, levomilnacipram, and then there's one, Savella, which in the United States is not used for depression. We use it for fibromyalgia. It's called milnacipram. It treats pain. These drugs, Cymbalta is also known to treat neuropathic pain. They work great. I'm not saying I don't use them. I use all the classes. Every one of them has its particular use. I'll repeat, we pick it by how the drug works, what family it's in, and also we pick it by its side effect profile. The next one, mirtazapine, Remeron, works great as an antidepressant, can make you drowsy, make you fat. It's a big problem. Those two things can be really problematic. So we use it sometimes. Sometimes people aren't eating, so you want to use it, and they're not sleeping. So it has its uses, usually in the elderly who aren't eating and sleeping. Then there's a melatonin agonist. I love this drug. Agomelatine. But we don't have it in the US. It's in Australia and Europe. I don't know why we don't have it. I was reading about it in 2011, and then the FDA was like, we don't like it. So there must be something wrong with it. Our FDA would never prevent us from having a good drug, right? So it affects melatonin. It antagonizes melatonin at the melatonin 1 and 2 receptor site, releasing norepinephrine and dopamine. It sounds great. When I go to meetings, people tell me they use it, they like it, it's one of their go-to drugs. So I'm not sure it's why it's not available here in the US. The next one, I did a video on this one, brexanolone, Zulresso. It's pretty much a progesterone agonist type drug. It's used for postpartum women. It's given IV in the hospital. It works great, but it's very expensive, and I don't know about its use for most people. It's for postpartum depression. Women who've had a baby and are depressed, it works great. It's a good drug. It's a novel mechanism of action. It's the future. Okay, so now we're at selective serotonin reuptake inhibitors. Luvox, fluvoxamine, Prozac, fluoxetine, Zoloft, sertraline, Paxil, paroxetine. Then there came Celexa, citalopram, escitalopram, which is the left version of Celexa. There's a left and right of every drug, racemic isomers, that's what it's called. And this one happens to be the left side of Celexa. It's called citalopram, Lexpro. And let's see, did I name them all? I think I did. These are the go-to drugs right now for first-line treatment of depression because they're safe in overdose. Their tolerability is very well. And then there's Trintellix. This is the drug that this video is about. I'm finally getting there. It is an SSRI, vortioxetine. It's one of my go-to drugs. Now, each class has my favorite. I am leaning towards this drug in this particular class. Now, this drug is a selective serotonin reuptake inhibitor. It increases serotonin in the brain, not the total amount, but the amount available. It allows the serotonin you have to work better. And then it affects, for people who are interested, the 5-HT3 receptor. It antagonizes that and stimulates the 5-HT1A, which is important. And for all you buffs out there, there are 15 serotonin receptors, and there are 3 families, and there's more all the time. Here's the problem with SSRIs. Great drugs, you can't overdose on them. Their side effect profile is very good, with the exception of Prozac that interacts with tricyclic drugs, causing potentially a fatal drug interaction. They're very, very safe. They're non-addicting. Most don't have a bad withdrawal syndrome, with the exception of Paxil, which is a horrible withdrawal syndrome. And most of them don't cause drowsiness, with the exception of Paxil, which makes you drowsy. Most don't put on a lot of weight, with the exception of Paxil, which puts on weight. So they're a very good group of drugs. Now I'm just talking about the one I like for depression, and that would be vortioxetine Trintellix. This drug can be given once a day. I like that. It's got a long half-life, like 66 hours. So if you forget a day here or there, you're fine. Drug kicks in about 2 weeks. Maximum benefit 6 to 8 weeks. Side effect profile. Here's the thing why I like it. It's got a lot of GI side effects, but they go away. Give it 5 milligrams per week, then go to 10 milligrams. And if you could make this drug work at under 10 or under, it doesn't really have any sexual side effects. Minimum. I'll almost say virtually none. If you have to go to 20, you may get some. But of all this class, this one at 10 milligrams has virtually no sexual side effects. Bing, 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 bing. No weight gain, no drowsiness, and no risk of overdose, no serious drug interactions. That's all good. The other ones each have problems in these areas. I use them, but they have these problems. It's the only one where I could say the side effect of sexual dysfunction is the best. And it has all the advantages of all the other selective serotonin reuptake inhibitors. So I give this drug with a little food, 5 milligrams per week and then 10. And if I can get it to work at 10 milligrams, it doesn't have a withdrawal syndrome, no weight gain, no drowsiness, no sexual dysfunction, no decreased sexual drive, no delay in orgasm, no problems with erection. Hello. No trouble with sleep. It's got some problems. You get a little nausea, diarrhea, dizziness, dry eyes, maybe constipation, but it's rare. Abdominal gas. They all have funny dreams. Vivid dreams you remember. Itching skin, redness under your skin. I like it. Remember, all these drugs, all antidepressants, people under 26 have increased suicidal thinking. There's something interesting about all these drugs too. They all affect sodium and may decrease sodium. It's the antidiuretic hormone is affected and it drops sodium. That could be a serious problem. They all can affect serotonin, causing a serotonin syndrome. I've seen it. People are shaking, shivering, diarrhea. They get all tight and then they seize and it turns into a nightmare. I've had it happen. And I'm in the emergency room giving muscle relaxants, Valium. You got to stop the serotonin pushing fluids. You can pound through it. Can never give them a serotonin drug again. So I like this drug. I will give it best in class. Nothing could be perfect. So what isn't perfect about this? Well, Zoloft, sertraline, or Prozac, fluoxetine costs like $5. This one for 10 milligrams is $505 a month. Wah. So, listen, it's the best drug in this class, but it's expensive. The other ones are all generic. This one is brand. News alert to everyone. I don't do any speaking. I take money from no company, so I'm saying whatever I want. This is just free speech here. I'm just trying to promote my own site, educate people, sell my book. Oh, by the way, shameless plug, Tales from the Couch. Would someone please buy this book? I'm decreasing my ratings on Amazon. I used to be up there. There's 8 million authors on Amazon, but I am in the top 100,000 sometimes. Anyway, Trintellix, under 10 milligrams, great drug. That's a review. Thanks. I appreciate everyone subscribing to my channel. Leave comments. Also, I have a blog at dragresti.com. That's just a lot of work that I write an article every week. It just keeps me busy. I enjoy writing the articles. Check them out. And now I realized after 10 years that the reason I never got any comments because it was turned off, and I turned it on last night. Yay. Bye.